When you look at a medical practice, it's easy to see each department as its own world. The call center, the clinic, the billing office, but the truth is, every part of your operation is connected. What happens on the front end directly impacts the clinic, and what happens in the clinic directly impacts billing and revenue. If one part of the system isn't working well, it creates a ripple effect that your patients and your bottom line can feel. Take the call center, for example. When the phones are ringing nonstop and the queue is full, staff are often forced to cut corners and move quickly to the next call. Maybe they don't verify insurance, or they miss collecting key details from a referral. Fast forward, when that patient arrives, check-in is delayed because the front desk is now scrambling to fix what was missed. The clinic staff, already behind, rush through rooming to make up time. By the time the provider sees the patient, they're 30 minutes behind schedule and documentation gets rushed. Here's the kicker. Those rushed notes don't line up with coding, claims get denied, and revenue takes a hit. What started as a call center issue ended up impacting the entire practice. Our approach is different. We don't just look at one department, we look at the whole system. On the front end, we assess how patients are engaging, how calls and referrals are handled, and where processes break down. In the clinic, we review workflows, communication, and documentation to ensure the providers have what they need to deliver care efficiently. And in billing, we look at how those upstream steps are affecting downstream revenue and cash flows. We don't just fix symptoms, we fix the process end to end. Along the way, we also analyze your technology. Where can automation take pressure off your staff? Where can analytics help you identify bottlenecks before they become problems? We have our own powerful tools, like a robust telephony with deep call analytics and automation options. But even if you don't adopt our technology, we'll work with your current vendors to find the best solutions and recommend changes based off best practices and experience. At the end of the day, our goal is simple: to align every part of your practice so the front end supports the clinic supports billing, and the entire system works together. When that happens, patients have a better experience, providers can focus on care, and your revenue cycle becomes stronger and more reliable.